Welcome to INP4. In this video, we're going to cover converting a non-saline lock IV to an IV that has a saline lock attached to it. Sometimes, and you'll find this probably more when you work in acute medicine, when you have patients who come up from emergency, they don't have the saline lock attached. And so we need to add a saline lock. The saline lock gives us benefits. This is the saline lock here. Gives us benefits of being able to stop the IV at any point in time and disconnect the patient from it so they can walk around or just take a break from it. Okay, so the first thing we'll have to do is, and you don't need a doctor's order, by the way, to convert this to a saline lock. So the first thing we'll have to do is stop the IV from running. But before we even do that, I want to show you a few things you will do before you even enter the room, getting your equipment ready. First, you can prime the new saline lock set that you're going to take into the room. There it is. You've got your syringe here, your preloaded syringe of saline. And please don't forget with these, just generally, a good habit to get into in general with these is to break the seal. So you can unscrew the cap and just push forward. There, seal's broken. And then you can just prime up so you don't have any air in there, prime right up. And then you can put the lid back on so you can take it into the room safely. If you don't get in the habit of breaking the seal on these preloads, then when you're actually flushing a patient IV, that popping that comes with priming this, breaking the seal, I should say, can actually pop the IV right out of the vein, and then you lose the IV site. So that, what I just showed you is a good habit to get into every time, no matter what you're using this for. All right, so this is ready to go. Then I already took this out of the package, so I should really swab this with alcohol, but just rewind and say, take it out of the package now. It's all still sterile. So I can just simply attach this syringe to the saline lock. And I can prime it right now. You'll see the fluid running through the tube. There, it's primed. It's okay if you even go right to the end there. Okay, so it's all nice and primed. Don't need to lock it up. That's a closed system. I can carry it into the room like that. It's all closed up. Nice, ready to go. The other thing I might want to do before I go into the room is take my new Tegaderm, which I'm going to use, and label it. So I want to label, well, this is a bit tricky because actually these are labeled usually on IVs with the time that the IV was inserted. So, I mean, if the IV wasn't inserted today, that's a little bit tricky. Make sure it's documented somewhere in the Cardex how old the IV actually is. So you may want to label this. You may just want to double check the date to see if that's appropriate, depending how old this IV is. Chances are it's a new IV from today, so putting today's date on it is okay. But you have to check that. So you can get that ready, get that all opened and labeled as needed. Okay, I'm bringing in some sterile gauze as well. Some alcohol swabs. I'm going to need this. This would still be in the package, but that's a dead ender to seal off the IV line. So we'll just have to imagine that's still in the pack. Okay, so there that is. And I'm going to need gloves. So now I'm in the room. Explain to the patient what I'm going to do. Wash my hands, obviously. Stop the IV from running so you don't get IV fluid all over the place. So you stop the IV from running. Your IV cannula goes into the skin somewhere around here. You have to guesstimate the length of it. It's about that long. So you want to put your fingers beyond that to kind of occlude the vein so you don't get blood everywhere. Of course, if I'm working alone, before I do that, I'm going to want to have to open up this. This is a skill I will often do with someone else in real life because it can be a little more trickier than this in real life. So this is nicely opened. I have to peel off the tegaderm that's here already. Peel that back. Okay, so even take it right off. But peel that tegaderm back. Occlude that vein the best I can. Then you unscrew the IV. Okay, so you might need a bit of coordination here. Hold on to that. Preserve that, because if you touch that, the system's gone. You got to throw it out. Can't swab that. Okay, take your IV cap, place that on. Put that up there. I'm hanging it on the, you can't see it in the camera, but I'm hanging that on the IV pole. So my IV line is safe, protected, and out of the way. Now again, sorry, I didn't mean to touch that. I'm still occluding the vein here. So not much blood's coming out. I may have wanted to put this gauze down beforehand to catch any blood that might come out. Okay, then I take my extension set, take the cap off, attach it. I'm still occluding that vein. Now I can finally let go of the vein because we're all attached. From this point, it really depends on you. I like to set all my dressings up first before I flush. I like this IV to be well supported. So I will place my tegaderm down. I'll stick that over top. Okay. Let's just do that. Stick the tegaderm on. Sorry, can't have the gauze in there. That's what I was. Can't have that gauze in there. The IV set up backwards. Oops. Okay, so then you stick that gauze on. Sorry, stick the dressing on. Peel it off. Then you want to anchor it with the label that came with this dressing. This is good practice for anything, whether it's an IV or a butterfly. That's where you'd have your date and stuff on it. Anchor that down there. Then you can flush, reopen up your vein. This is one of our labs IVs is actually broken, so it's not allowing me to flush. So imagine I'm flushing, flush, 5 cc's of saline in. I've flushed 5 cc's of saline in. Now all I got to do is get my IV line back. Switch these back. Push and twist. Put a piece of tape on here to tape this in a nice semicircle, like that. And start your IV running at the right rate. You now have a saline lock in situ.